Hello and welcome to the Quincy Access Television Studios. I'm Mark Crosby. Thank you so much for joining me and my guest as we, cover this topic, and I know we're going to cover this topic to the utmost, and that is managing seasonal affective disorder. And my guest, Caitlin Kirby from the Quincy Health Department. Welcome back.
Yes, thank you for having me as always.
Great to have you. It's a mouthful, this topic, but so important because our mood is, based or affected by seasons.
Yes, so as a public health nurse, mental health is a very important topic for general population in our country and all across the world. So just as we're getting into these winter months, which is where you most commonly will see the seasonal affective disorder, I thought it was very important to go over what is this, what to look out for, and when you should maybe reach out for help for yourself or a loved one if you are feeling down at this time of the year.
And I guess what helps too is that to realize you're not the only one possibly suffering from this, that there are others.
Yes, and with a lot of medical conditions, mental health conditions, you can feel very alone, and that isolation can only worsen your condition a lot of the times. So as you had mentioned, finding out you're not alone and realizing that many people deal with this. It doesn't make it any easier on yourself, but it does kind of gives you the chance to open up to help a little bit more when you know, again, you're not alone.
Right, and of course, the more you know about any topic, the better off you are.
Yes, yes.
So let's look at the overview. We will start with what is seasonal affective disorder, SAD, signs and symptoms. How is SAD diagnosed? Who is at risk for developing SAD? What causes SAD? Treatment, and then we will end with resources.
Yes.
So definitions are always the best way to start.
Yeah, so seasonal affective disorder, otherwise known as SAD, S-A-D. So according to the National Institute of Mental Health, it is very common for individuals to experience short periods when they feel down or unlike their usual selves during season changes. Especially when the days get shorter in the fall and winter, which is referred to as the winter blues. But sometimes this mood changes is more serious and can affect how the person feels, thinks, and behaves. And when there are significant changes, that's when we get into the seasonal affective disorder. So it's almost its own category of depression, which sounds very scary, but it's very common for people to have. And again, knowledge is power. Knowing why your mind is working a certain way can help you get out of that and find tips and tricks that work for you to feel better. So I think it's also very important to know that it could be during any season. So we could have it during the winter months, which could be also called winter depression. And these symptoms would start late fall, early winter, and improve as we go towards the spring and summer months when we get more daylight. And there is also a summer pattern SAD or summer depression, but this is less common, so there's a lot less studies about the summer seasonal depression.
Right, because, well, I suppose right, who am I to say right, but there is less sunlight, so that is a contributing factor. There is less sunlight in winter than there is in summer.
Yes, and it's interesting because it even has to do with like how close you live to the equator, like how the amount of sunlight that your area where you live, like it would affect us more so up in New England than down in Florida, or like those southern states where they have more warmth and sunlight throughout the year.
And I guess just getting to the visual aspect of it, the trees are bare and they're sticks. not very attractive as opposed to leafy trees. So you could see where the landscape might not be as inviting.
Yes, a Taylor Swift song pops into my head with that, saying it's like gray November. Doesn't sound very joyful when you think of a
Right.
gray November.
Absolutely.
So it all goes hand in hand. So again, it's common. So I think it's so important for people to see these symptoms and say, oh, I actually experienced that. Just so you know, whether it's common or not, you're still going through it. So I think it's so important to know how to get yourself out of it.
Right, absolutely. Signs and symptoms.
Yeah, so SAD, it's again a type of depression, and it's characterized by recurrent seasonal patterns with symptoms lasting for 4 to 5 months out of the year. So when we look at the symptoms, we broke it down. So there are symptoms of depression, and then there are symptoms specific to the winter pattern. So it's important to know you may experience some of these, but an individual may not experience all. But some symptoms you may see is persistent sad, anxious, or an empty mood that can last nearly every day for at least 2 weeks. Feelings of hopelessness, feelings of irritability, frustration, feelings of guilt or worthlessness, loss of interest in or pleasure in hobbies or activities that once made you happy, decreased energy, fatigue, feeling slowed down, difficulty concentrating, changes in your sleep or appetite, or unplanned weight changes, physical aches or pains, headaches, cramps, or digestive problems, and thoughts of death or suicide. So if you or a loved one experiences any of these signs of depression, I want to say right now, reach out to your doctor, especially if thoughts of suicide or death. There are helplines you can call, and those are like 24/7 helplines, because those are very serious and you want to address it right away. And then for the winter pattern SAD, you may also have oversleeping, overeating, particularly cravings of carbohydrates leading to weight gain, social withdrawal. And I'd like to say it's a lot of mental health goes hand in hand. You can have like comorbidities, but I'd like to say that SAD is not the same as the holiday blues, because you will see like the holiday blues, that's more so towards like, you think of like the winter holiday season.
Right.
And that could be more specific to that time period, because as we go through life, our lives change, we lose loved ones, our holidays may not look as joyful as they once did when we were a child. So the holidays can be a very stressful season for people. So it's not to neglect those people who are they may still feel those holiday blues. But when in doubt, where it can be hard to decipher, talk to a loved one or talk to a healthcare provider just to kind of say, this is where I'm at. Do you think I should be getting help or seeking any avenues?
Which then leads us to diagnosis. So how is an individual diagnosed with this disorder?
Yeah, so it would go through your healthcare provider or a mental health specialist. If you don't have a mental health specialist, your provider will likely refer you to one. And the criteria that is used to diagnose SAD, there are 3 main criteria. So the first one, the symptoms of depression, or more specific symptoms are winter or summer pattern SAD, listed in the previous slide. The depression episodes occur during a specific season, either winter or summer, for at least 2 consecutive years. But it's important to know not all people do experience it year after year, which is is a good thing. And lastly, the depression episodes during the specific season are more frequent than depressive episodes experienced at other times of the year. So again, it really takes a specialized mental health professional to examine what's going on with you, to determine what you may be experiencing. We've said this in many episodes before, but like stress is a normal bodily function. We need stress to react and keep us safe. But having long-term stress is not good. So when in doubt, check in with someone and just know you're not alone, because it can be very isolating, and you may feel like you don't have other options, and there are always other options and many resources. So when in doubt, if you don't know where to start, you can call your local Board of Health or even your local police, and just ask, like, this is what I'm dealing with. Do you have any advice?
Now, who is at risk for developing SAD?
Yeah, so really anybody could experience.
As I was asking, I was thinking, yeah, that could be everybody.
Yes, because we're all humans are very complex, and it all like
Well, I'm less
everybody's.
complex than most.
Yeah. Everybody has their own outlook on life built by their own experiences.
Sure.
But according to the National Institute of Mental Health, it's estimated that millions of Americans experience SAD, although many do not know that they're experiencing this common disorder. Factors that may influence the likelihood of experiencing it, we see with the younger population and with women, they're more likely to experience it than men. Also, we think of the geographical latitude. So the prevalence increases the higher latitudes with SAD, based on living, like how far they live from the equator. So again, you think of the fewer daylight hours. So here in New England, we get less sunlight at this time than Florida does. So our population may see it a little bit more prevalently. It is also more common in people who tend to have other mental disorders. So whether that's depression, bipolar, attention deficit disorder, eating disorders, anxiety disorders, and panic disorders. And then also we see it run in families if they have these other mental health disorders.
Yeah, that's interesting. The other thing I'm thinking too, especially as a child, but adults as well, is that during the winter months, there is flu often circulating,
Yes.
and other sicknesses that you don't normally see in the warmer months. So certainly that's something to feel sad about.
Yes, and during the summer, we're out and about. We're in the sunshine. We're getting fresh air. Whereas in the winter, you might be locked at home, sick, not feeling your best. So there are a lot of contributing factors.
And we're going to look actually now at some causes.
Yeah, so researchers are still determining what causes SAD, and most of the research to date has found some common things people might experience. So especially with our winter seasonal affective disorder, we may see individuals have a reduced level of the brain chemical called serotonin. And serotonin helps regulate a person's mood. And as we keep saying, what your body needs to build serotonin is sunlight. So the sunlight affects the level of molecule that helps maintain normal serotonin levels. So when those levels aren't being maintained, you could find yourself not feeling as well. We also see vitamin D deficiency. So this vitamin is your body produces it when you're exposed to the sun. You can also get this through diet or vitamins. and it's used to promote those serotonin levels. So the vitamin D and serotonin go hand in hand. So a lot of times when we're not out in the sun getting that vitamin D, check in with your doctor and they might recommend an over-the-counter vitamin D supplement during those winter months to help stabilize the production of your serotonin.
Well, because there's less sun, I believe, during the winter. And then even when there's sun outside, if the temperatures are cold, it's not that inviting.
Yes, and you're bundled up, so you're not getting as much sun directly onto your skin.
Altered levels of melatonin.
Yeah, so melatonin, so this hormone is important for maintaining the normal sleep-wake cycle. So people with winter pattern SAD produce too much melatonin, which can increase sleepiness and lead to oversleeping. So a lot of times in the winter you feel more lethargic. It's harder to go about your everyday routine because you just want to stay in bed.
Because it's also warm in bed. You have
Yes.
your covers you can pull up. And again, you might look out the window and see snow on the ground and that not seem all that inviting.
Yes, yes. And you could say like, oh, these people should go on vacation, but that's not always easy. That's not obtainable, especially in today's economy where
Sure.
everything's very expensive.
And then that's good for that period, but then you would come back and you would still have the same, I suppose, triggers at home.
Yes, yes. So you want to work with your healthcare professional to figure out the best plan of action to treat your own condition here.
That brings us to treatments, and they're probably varied. Light therapy is
Yes.
one, which isn't a big surprise.
Yeah, so the treatments fall into 4 main categories, and they can be used alone or in combination. So we have our light therapy, psychotherapy, so that could be your talk therapy with a therapist. We have antidepressant medication, and also vitamin D.
Now, does vitamin D, as a person ages, does the level also decrease? Do we know?
So, I do not.
Or though,
Yeah.
I suppose kids have no problem going outside as
Yeah.
younger people, and maybe and therefore being exposed to sunlight more than maybe they
Yes.
would later on. Teenagers nowadays are gaming, so they're not even out.
Outdoors as much.
as much.
Yes. So I don't want to say, like, to answer that, I'm not totally sure, but there could be contributing factors and other health conditions a person may experience that affects their levels.
Sure.
So it's very individualized. So consult with your doctor about vitamin D. And you also, even before taking over-the-counter supplements, I always say consult with either a pharmacist or your doctor, because they'll see other medications you're on and what it could interact with. So any of those supplements, you really want to talk to your doctor. And I'd like to say too, with the antidepressant medication, a lot of those are SSRIs, so it's a serotonin reuptake inhibitor. So it affects your serotonin levels. But again, there are many different brands of those on the market, so something might work for someone and not the other. So it's very individualized. And it also, none of these things are a quick fix. It takes consistency, and it can take like 4 to 6 weeks to, like, if you start a medicine, it might take 4 to 6 weeks to see the effects of it. So anything, you want to make sure you have like a little team, even if it's your healthcare team working with you, because you're not going to see this episode, start this tonight and feel better tomorrow.
Right.
It's an effort of working together and taking this step by step, day by day. And I always like to say healing is not a linear. You're not going to just heal day by day by day. You might have downfalls and then get back up again. So I'd like to, as I always mention, talk to your own healthcare professional, see what resources are available for you and your community. And when I say resources, if you, when in doubt, call your local board of health. And if they don't know, they'll figure out who to refer you to.
And just looking at how some of these treatments are utilized, so light therapy and vitamin D most commonly used for the winter
Yes.
depression or the winter period.
Yes. Because we're the summer, it's a little bit hard. Research, it's harder to narrow down the summer seasonal affective disorder. We more so see the winter, and it's a little bit more evident with like the sunlight. So it all depends specifically to that person.
And I guess summer rather, you've got, I suppose if the temperatures are too hot for someone to go outside, even though it's sunny and bright, that person isn't getting the sunlight, isn't being exposed to the sunlight, therefore that's a deficiency.
Yes, yes. And there, people may have conditions where it's difficult for them to leave their home. So there's many things that could contribute as to why you may have this. But again, it's just important knowing what is it, and you're not alone. Because so often it's, oh, you don't have it as bad as me, get over it.
Right.
And that's not, I get that could be what society tells us to do, but you have to take care of yourself. And at the end of the day, nobody's gonna come rescue. You are your own rescuer.
Right.
So I'm a big advocate for managing your mental health and seeking help when it's needed.
And I know I brought this up, and you kind of brought this up as well, but because you were talking about, I think, your nephew who likes to play video games, right?
Yes.
He's 14. And that certainly my child as well, and he's now 21, and I think he still plays a bit too many video games. But with that said, you're in a darkened room. You're not getting, even in the best months to get the sunlight, you're not out there getting that sunlight.
Yes, so
So it's a behavioral pattern.
it could, yes, behavior, that's a good point, because a gamer who may sit in a dark room all day, they're not getting the vitamin D, so you might see other mental health going along with that. So I like to advocate to really do your basics, get your sunlight. If it's recommended, take your vitamin D. And one thing that I do think people could benefit from is like an outdoor walk every day. But again, it gets difficult in the winter when the streets get icy and cold. But it's really just about maintaining your overall health, getting your exercise, and taking care of yourself.
And I suppose, although certainly it is affected, you had mentioned hobbies and interests can become less important to an individual that's going through this. But I'm thinking what is probably beneficial is just keeping your mind active. In other words, pushing through it to a degree. Again, asking for help, certainly. But I almost want to say don't succumb to that. Don't succumb to sad.
Yes, you want to try your best, because it can be hard. Like even when we talked about those holiday blues, maybe you don't want to go to that party, but you know it would make everybody happy to be there. I'm very big at myself, whereas I get stressed out before the event, and then I go to the event, I'm like, well, that was lovely. So you want to be kind.
I think that's all of us.
Yeah, you want to be kind to yourself. And yes, it is okay to put your mental health first and say, that's actually going to stress me out and I'd rather stay home and read a book. But don't give up on what you love. And that social events might not be everybody's cup of tea, but figure out what your cup of tea is and what makes you happy.
And I think getting back to holiday blues, and you had mentioned the loss of a loved one, there are grief counselors that can help you.
Yes, grief counselors, groups as well. I know our Council on Aging in Quincy, they have a group that gets together because as we're all humans and as we go through life, we do lose our loved ones, and it gets hard. Even at 30, I'm in my 30s, and our daughter will be 18 months this Christmas, so she's bringing back all the holiday cheer for us.
Sure.
But again, it's hard not to look back at the time when my grandparents were around the table, and it's hard even at my age. So I always like to say, like, even if you are grieving a loved one these holidays, try to think of a memory that you did together and try to just, even if you can't relive it, if you can't do that again, do something to honor that memory.
And I guess this just popped into my head, but regarding seasonal affective disorder, is it more likely to affect a person who might be alone as opposed to one living with either another person or living with a pet?
So it really depends individually, because somebody who lives in a home with 15 other people may experience it just the same. But I love where you bring up pets. Pets are very good for like nervous system regulation. In making you feel better, because they give love. They're the one thing that is going to love you more than they love themselves. So just finding, again, what makes you happy. And there are many different avenues to mental health therapy. Even like they do have comfort dogs and comfort animals. So maybe you don't have a pet of your own and you can't take care of a pet, but maybe you could find where an animal goes to visit once a week. Like I know they come to the Council on Aging every now and then. So again, reach out to your community and figure out what's available around you, because no one should feel that they are completely alone in this life.
Very good. And yes, mentioning pets, when my son, who is now 21, but when he was younger and not feeling well, he would pretty much, this was the only time he paid attention to the pet. We had a pet rabbit. And when he wasn't feeling well, he'd go and grab the rabbit and hold the rabbit for a while, and that made him feel better.
Yes.
It makes sense.
Yeah, I've read that with like dogs too, because when they get anxious, they shake out the energy, so it gets their body back to a regulated nervous system state. So it makes us as humans, it makes you feel very regulated and calm being around them.
Yeah.
So it's fascinating, the world of mental health and how much is out there today, how many resources, and there's so many avenues. So again, if it doesn't work for you, find a different avenue. And if you don't know where to start, again, call your local Board of Health and just say, this is what I'm thinking, who would you recommend I reach out to?
Right, don't suffer with it.
Yes, yes.
I want to thank you again for joining me in studio with another informative show. Thank you so much.
Thank you so much for having me.
And it's a big hit. These shows go, as you know, across the country, so they enjoy what you have to offer there as well.
Which is wonderful.
It is.
Yes.
And thank you at home for watching. Please continue to support the local access center in the community in which you reside. Take care.